Welcome to our conversation tonight. We're here with my brother, Dr. Brian Baird, and he is on the board at People's Bank and also works at Cabot Emergency Hospital and at Medical Center of South Arkansas. He's an ER doc. I'll let him tell you a little bit about his credentials as a doctor, but I'll turn it over to Brian.
So I'm Brian Baird. I'm an emergency physician, board certified emergency medicine physician. Been out of residency since 2013. I work at the Medical Center of South Arkansas and Cabot Emergency Hospital. And as Jonathan mentioned, I'm also a member of the board of the bank, People's Bank Magnolia.
All right, great. So tell us a little bit about the coronavirus. For a lot of people, they don't know what it is, where it came from, just kind of a short thumbnail sketch about what it is.
So basically, there's not that much that's special about the coronavirus itself, other than it is a different strain of a virus that's been around for a long time. So you typically think of coronavirus as something that would cause a common cold. So your typical cough, congestion, runny nose, sore throat, maybe a low-grade fever. And we have that kind of thing all the time, goes year-round. And this is a particular strain of that virus that in particular binds to receptors that are more prominent in the lungs, and therefore it causes a lot more damage to the lungs, makes it hard for people to breathe in some cases, and just tends to have a worse outcome than what you would typically have with your regular old run-of-the-mill coronavirus.
Okay. All right. Anything else as far as, I guess this is one that has been transmitted from, it's normally in like cattle, livestock?
So they theorize that this started in an animal and basically mutated and was able to be transmitted between an animal and human. Mm-hmm. And that's what they theorize at this point. We don't know for sure exactly where it came from, but that's the running theory.
And how is it transmitted?
So just like any other coronavirus, any other common cold, is transmitted by people coughing and having their hands up. They get droplets on their hands. Mm-hmm. They touch something, then you touch that, touch your mouth, touch your eyes, touch your nose, mm-hmm. and the virus gets into your body in that way. Or if somebody coughs directly into your face, or sometimes they theorize that it could even be spread through the air. If somebody coughs or sneezes, it could the droplets can spread through the air, and you could inhale the droplets or the virus in that way.
Okay. And so what are some common sense steps you can take to prevent the spread of it? And what is the goal? What's the goal of the medical community at this point in the spread of this virus?
Whenever any type of bad infection, whether it's a bacterial infection or a viral infection, enters into any community or country, like in the United States, we had the Ebola crisis where we had some cases coming to the country. Initially, you want to try and isolate anybody that's been exposed to that or anybody that's potentially been exposed to it, and try and keep that from getting spread into the community, where then it is spread between people, and then it just goes on and becomes exponential. We are at this point, we're getting close to being past the point of containing it and keeping it from coming into the country, and now it's all about mitigating and trying to minimize the spread, or at least slow the spread down between person to person and communities in the United States.
Mm-hmm. Yeah, and so the main risk really isn't so much the effect of the virus on an individual, but the overwhelming of the medical community, right, in our facilities.
Right. So the worst case scenario in my mind is we have so many people that have to be admitted to the hospital, to the ICU in particular, that we take up all the ICU beds, that we are using all of the ventilators in the United States, and we have to decide who gets a ventilator and who doesn't.
That's going on in Italy right now.
Right, exactly.
They're having to make those decisions.
And that's what we don't want to do, is we don't want to get to that point.
Yeah, so there's a chart out there that I've seen that kind of shows the peak of how viruses start or what happens in a pandemic. What we want to do is just spread that out a little bit, right. And I'll put that over this. But
so the idea is we're kind of past the point of stopping it totally, So what we want to do is try and at least spread it out or slow down the spread of it to the point to where the medical system can handle new cases as they come about, rather than having a huge spike in cases that totally overwhelms the entirety of the United States, and we don't have anywhere to put people.
All right, so we've talked about what it is, what the goal of our interventions and our mitigation efforts are. What are some practical things that we can do to slow the spread of it or to prevent the spread of it potentially?
So basically, I would just say back to the basics. Hand washing frequently, anytime that you come in contact with another person, whether you think they might have the virus or not. Go to the grocery store, you touching the door, touching anything, down the aisles, a shopping cart, anything where you may have been exposed to any type of infection, you want to wash your hands. And just day to day, people working, your normal jobs, wash your hands frequently anytime you come in contact with a customer, and then washing surfaces, keyboards, anything that you can do to minimize the viral load that's on things that are around you at all times is kind of the idea.
Fist bumps are good.
Fist bumps are better than handshaking.
Yeah.
But I mean, if you're washing your hands in between every contact anyway, I mean, like as a physician, I wash my hands before I go into the room to see a patient, wash my hands after I go out, or you can use alcohol sanitizer and you can, clean.
What's
clean
an
your hands that
effective,
way.
okay, so there's a difference, obviously there's a difference between washing your hands. What's the best practice on actually washing your hands? Just get real practical.
So you want to at least wash your hands for 20 seconds with soap and warm water. And basically what they always say is sing happy birthday to yourself. Okay. And that should be enough time to where you've given yourself 15 or 20 seconds of washing your hands. It's all about the friction. You don't even necessarily have to use soap as long as you got plenty of friction washing your hands. Most of the work is done by that and the warm water by itself.
So warm water, I mean, what about, is warm water even a necessity? What if it's cold? Is cold water okay?
It's probably okay.
Better, but best practice is warm water, 20 seconds.
Right.
Good suds to get because you're breaking down the oily packets that the virus is in.
Just basically washing it off your skin. I mean, if you don't wash it off your skin, you're hopefully killing the virus or the bacteria that's still left there.
Yeah. Okay.
And most of the time, 20 seconds is enough time to do that.
So for hand sanitizer, some people don't. I mean, hand sanitizer's in short supply. I saw a guy selling some on the corner back earlier. What if you don't have that?
$20 a pump.
$20 a pump. The kid got expelled from school for selling that. I thought he was just being a good capitalist, but
sounds legit.
Yeah. So if you don't have hand sanitizer, what if you just have isopropyl alcohol? Is that like if you use that?
It depends on the percentage. I mean, they say that ethanol, you want a 70% ethanol or more on your hand sanitizer. It should work just as well if it's isopropyl alcohol. But the thing is that it has to be completely dry in order for the virus or the bacteria to be lysed and to be killed or inactivated.
Okay, so that gets to the way you cough and the way you sneeze, right? Because if you cough into your hand, I mean, that's the perfect way to transmit it.
If you want to transmit viruses and bacteria, that's the best way to do it. Yeah. Cough into your hand and then immediately shake somebody's hand. Or touch something that somebody else is going to touch.
So can you demonstrate for us the proper method or the proper form?
If you don't have a cloth or something to cough into, then you want to try and cough into your elbow. And, hopefully that will be less transmission of a virus than if you just cough directly into your hand.
Is it better
it'd be better to have a cloth or something to catch it, because that would keep it from spreading. Either way, I mean, that's not ideal to cough into your elbow, but if you're out in public and you may be touching things that other people are going to be touching, cough into your elbow rather than into your hand.
Okay, but the best would be to have like a tissue in your hand, I guess, and then to wash your hands after
and then
that.
Wash your hands afterwards. Because the thing about this virus is that they believe, or at least we believe, that it can be spread. There was a Chinese PhD doctor that showed by reviewing videotape on buses that there were people that were within 6 feet of a guy that had a confirmed coronavirus infection, and he spread that to several of those people that were within 6 feet of him. And so it could be more airborne than what we think. Probably more just droplets from coughing and things spreading. The guy was probably coughing and sneezing on the bus.
Because if it was truly airborne, I mean,
you would expect it to be way worse and way more transmission than.
I mean, there would be no containment of it at that point, probably.
Probably not.
Probably.
Yeah, probably not.
Okay. All right. Anything else? Well, that brings up the social distancing thing. So, for just people, regular people, what would be some good best practices for them, just from the perspective of social distancing and transacting business and doing stuff like that?
I mean, in general, try to minimize your exposure to large groups of people. I mean, if you can conduct your business from home, then it would be best to do it that way, and not trying to make people panic or anything. But, like for example, at the bank, I would recommend that if you can go through the drive-through instead of coming into the bank itself. If you can do mobile banking, that would be better than coming physically into the bank to check your balance or make a deposit.
And we just so happen to have a mobile app that would be great for you to use for that application. Yeah,
it's perfect for coronavirus.
And pretty much anything you can do in the bank other than depositing like cash, you can deposit checks on the app. You can transfer money between accounts. You can do bill pay. You can do all kinds of stuff on the app. So there's pretty much anything you could do if you came into the bank. There's a few things you can't, but for 90+% of transactions that you could possibly do at the bank, you can do that on your phone now.
Right.
So basically, you have an ATM, more than an ATM, a teller in your pocket.
Right.
With the app.
So that would definitely be better than physically going into the bank or any other business for that matter. I mean, at this point, we're trying to just minimize the spread among communities. We have a confirmed case, at least one confirmed case as of today in Pine Bluff, or presumed case. I don't know that they necessarily have confirmed it yet, but they had one presumed case in Pine Bluff today. And so it's in Arkansas. It's probably even in more places than what we know of.
We're probably behind, a couple weeks at least, probably?
We're way behind. It's probably, there's no telling how many more people have it than we know of.
Yeah.
And so it's just a matter of time before it, goes widespread, and we will find out the extent of it probably on the back end, but it'd be too late by that point. And so the best practice at this point, there's a lot of schools that are shutting down. There's, colleges that are shutting down, sporting events, any large gathering of people. There's a lot of those are being shut down. Disney World, Disneyland. And
Disney World shut down?
Correct.
Oh, wow.
Yeah.
I didn't know that.
So it's getting to the point to where we're really taking this seriously, and it's probably the best. I mean, a couple of weeks or maybe a month of doing things like this, if it can keep the medical system from being overwhelmed, then it's probably worth it on the back end.
What can you do with your family, maybe?
Here's what I would say. If I had to talk about my own family, I would try to minimize travel as much as possible, especially travel where you're going to be getting on an airplane in a confined space with people that you have no idea whether they have the virus or not. Avoid large crowds, concerts, Disney World, which is not going to be a problem anymore now. Any place, buses, trains, airplanes, anything where you're going to be in confined space with a lot of people, especially people that are elderly, because it's been shown that that's the number one risk factor for mortality with this virus. The older you are, the higher the mortality risk. It goes from age 60 to 70, you got a mortality risk of around 5% from the numbers that we've seen. 70 plus, it's about 10%, and then 80 plus is about 15%. And people that have COPD, any kind of lung disease, heart disease, diabetes, kidney disease are going to be even higher risk than somebody who doesn't have those things. But age is the number one risk factor that we know of.
Yeah. What about any good news? Let's end this part of the discussion on good news about the virus.
So the good news is that we're going to get through this. It's going to be fine. Eventually, this will pass, just like every other pandemic that we've had. And we're more prepared now, or more well prepared now than any other generation has been. We have more technology, more ways to treat people, more supportive care, and they were able to sequence the virus within days of it being found, which is unbelievable compared to what we've had in the past. So the groundwork is laid. So now we just have to hopefully slow this thing down, so that the biggest thing is we don't want to overwhelm the medical system. If we don't overwhelm the medical system, we have the technology to where we can take care of people and lower the mortality rate as much as possible. That doesn't mean that nobody's going to have a bad outcome, but we can try and minimize that as much as possible.
Sure. Okay. Well, that's a good discussion, and I want to turn the discussion to the financial aspect of it, because I'm writing a book, the CFO Dad, and so I talk a lot about financial planning, and one of my chapters in the book is about what to do when the mud hits the fan, so to speak. And we've certainly seen that happen in financial markets over the last couple of weeks. I've never seen anything like this. Even 2008 wasn't this severe as far as the drops in the market each day. Today, the day we're recording this, the market dropped right at 10%, which is just unbelievable. I want to say that it's an overreaction, and it probably is an overreaction, especially given the range of outcomes that are possible with this. From the most severe to the ones that we're hoping for, which are, relatively mild, I guess I could say. Yeah. Kind of the best case scenario is hopefully that it is something like a severe flu, as far as the impact. But
if I had to shoot from the hip and guess, I would say we're probably looking at an actual mortality rate of less than 1%. We don't know based on the numbers that are out there, but it's probably much lower than if you look at total number that we know have been infected versus the total mortality rate.
There's a selection bias.
Sure.
You're only looking at the cases that get on the radar.
Right.
There's so many, no telling how many cases that haven't.
There may be people that had little or almost no symptoms and wouldn't have been tested in the first place, and that's probably a huge number of people.
And so for that reason, I'm trying to encourage clients and people that are invested in the market and are thinking about these things to really, just kind of stay put. If you sell, that's kind of when you lock in your losses. And so right now is a good time, I think, to reevaluate your risk tolerance. Think about what kind of risks you're willing to take with your money. If you're nearing retirement, then you need to be scaled back anyway. And if you weren't, then it's probably not a great idea to scale back at this point, because you've kind of already taken a lot of the loss. Hopefully it's over. We don't know. It could go further. At this point, the Dow Jones is around 21,000, something like that. Market's down around 25%, which is a significant drop in a 2-week period, considering that last year the market was up around 30%. The U.S. markets were up about 30%. So right now is really not the time to panic. It's not the time to be selling everything. But it's a good time to reevaluate your risk tolerance, and I think that's a good thing to consider. For people who are younger, it's going to be much easier for them to weather the storm. For people who are older and nearing retirement, that's the ones that really need to think hard about what they want to do and how they want to mitigate, the risks of market exposure. But again, I think the byline on this is don't panic, don't sell. When you sell when markets are depressed like this, you lock in your losses. You've gone through the process, the painful process of losing a significant part of your assets potentially. If you sell, you just lock that in. And so I think it's better at this point, probably for people. And, again, it's different for different positions, for different situations. If you got all your money in oil stocks, that's really not good. That's a lesson in diversification, probably, that you should learn from this experience or from this episode in market history. But
so don't sell out and put all your cash under the mattress. Is what
no,
you're saying.
Definitely don't want to do that.
Don't buy gold and bury that in the backyard.
Don't
all of your money.
Yeah, don't do that. There are all kinds of assets that may make sense to invest in, and gold is not a bad asset, but at the same time, if you have all your money in gold, what you're betting is that the markets will never recover. You have no confidence in markets to create wealth. You don't believe that the risk return trade-off works anymore in the market. And so if you don't believe that's the case, then yeah, go sell all your assets, buy gold, bury in the backyard, buy a bunch of toilet paper and hand sanitizer, and stockpile that stuff. But for the rest of us who think that the markets are going to reward the risk that you take, then the proper thing to do right now is to ride it out. Again, thinking about mitigating the risk, thinking about scaling back your equity allocation in your portfolio, your overall portfolio, because you basically have two options. You can invest in equities or stocks, or you can invest in fixed income bonds, CDs, cash instruments, things like that are more safe. They have less volatility, less up and down movement. Stocks are where most of the volatility happens. But the problem with having all your money in fixed income is that you can't really get paid for the risk that you're taking in the long run, because there is also inflation. And fixed income returns generally return just a little bit above the inflation rate. So you really can't build wealth with holding all your money in fixed income. Whereas equities, we see the risky side of that is very clear and present to us, because when your portfolio drops 10% in one day, like it did today, potentially, it's really clear to us, that risk. And so we have a tendency to want to bail out and jump over into something that we consider to be safe, but we don't take into account the inherent risks in fixed income, which is inflation. So I want to thank Dr. Baird, my brother, for coming and sharing his wisdom and expertise with us on this. So we're lucky to have him and also our chairman of the board is a doctor on our board, and so they're very helpful in giving us advice on what to do. And so at the bank, we're going to be implementing a lot of the suggestions that they offered. And so again, this is not a time to panic. This is not a time to to lose our heads over something like this. It's not. It is serious. There are definitely some things that we need to take it seriously, and we need to do our part to be a part of the solution to this problem. But panicking is not a good thing to do. And if we follow, I think, some of these pretty simple, common sense precautions, we can go a long way to helping mitigate this situation and make things a lot better. And so that hopefully people, especially the most vulnerable among us, will have better outcomes. And that's really the goal, is to protect the people that are most vulnerable. And so we hope that this video has been helpful. And again, I want to thank Dr. Baird for being here and sharing his expertise.
Well, thank you for having me.